Hello everyone, welcome back to our channel CPC Adda. In this video, we'll see some practice questions on fraud, waste, and abuse. In our previous video, we have covered concepts on fraud, waste, and abuse, and in this video, we'll discuss about practice questions for CPC exam preparation. First question: which of the following is an example of healthcare fraud? And you have four options: submitting a claim for a service not rendered, and second option billing for a service at a lower rate than performed, and third option making an honest coding error on a claim, and option fourth undercharging a patient due to a clerical mistake. And the right option is submitting a claim for a service not rendered. Okay, this one comes under fraud. Submitting a claim for a service not rendered, option A is the right option. Okay. And next question, what does the term upcoding mean in medical billing? Asking about upcoding mean. So option A, coding a service for a different condition. Option B, assigning a higher level code than that was actually performed. Coding for a procedure that was not performed, that is option C. And option D, assigning a lower level code to avoid audit. So right option is option B, assigning a higher level code than that what was actually performed. Okay, option B is the right answer. Okay, next question, which of the following is not considered a form of waste in healthcare? Which of the following is not considered a form of waste in healthcare? Options: over ordering laboratory tests that are not medically necessary. Option B, prescribing a generic medication when a brand name is not required. Option C, providing services that exceed the patient's need. Option D, performing redundant diagnostic procedures. Okay, so right option is option B, prescribing a generic medication when a brand name is not required. This is not a form of waste in healthcare. Okay, option B is the right option, and all other three options are option A, C, and D are examples for waste in healthcare. Next question, abuse in healthcare involves. Abuse in healthcare involves option A, misusing codes on a claim without intent to deceive. Option B, billing for a services not provided. Option C, submitting a claim for services rendered but not documented. Option D, accidentally undercoding a procedure. So right option is option A, misusing codes on a claim without intent to deceive. Okay. Abuse in healthcare involves misusing codes on a claim without intent to deceive. Next question, which government agency is primarily responsible for investigating healthcare fraud? Which government agency is primarily responsible for investigating healthcare fraud? Option A, Centers for Medicare and Medicaid Services. Option B, Office of Inspector General. Option C, Federal Trade Commission. Option D, Department of Health and Human Services. And the right option is option B, Office of Inspector General, that is called as OIG. Next question. The False Claims Act is primarily designed to. The False Claims Act is primarily designed to. Option A, penalize healthcare providers for billing errors. Option B, provide protection for whistleblowers reporting fraud. Option C, regulate the prices of medical services. Option D, encourage the overuse of medical services. And the right option is provide protection for whistleblowers reporting fraud. Okay. So the False Claims Act is primarily designed to provide protection for whistleblowers reporting fraud. Next question, which of the following is a sign of potential fraud in medical billing? Sign of potential fraud in medical billing. Option A, consistent use of the same diagnosis codes. Option B, billing for services that are not documented in the patient's record. Option C, regular use of modifiers to clarify services provided. Option D, high patient satisfaction with services provided. And the right option is option B. Okay, billing for services that are not documented in the patient's record. This is considered as potential fraud in medical billing. And next question, a provider intentionally billing for a more expensive service than what was actually provided is an example of options. Option A downcoding, option B abuse, option C fraud, option D waste. And C question again, intentionally billing for a more expensive service than what was actually provided. This is example for fraud. Okay, option C is right option. Next question, which of the following is an example of fraud in medical billing? Which of the following is an example of fraud in medical billing? Billing for services that are never provided, providing unnecessary services, incorrect coding of services, overuse of diagnostics. This is a repeat question and answer is billing for services that were never provided. Next question, what does abuse in healthcare typically refer to? What does abuse in healthcare typically refer to? Option A intentional deception, option B practices that are inconsistent with accepted sound medical, business or fiscal practices. Option C unintentional errors in medical billing. Option D compliance with insurance requirements. The right option is option B practices that are inconsistent with accepted sound medical, business or fiscal practices. Option B is the right option. And next question, which of the following is a common sign of potential fraud in billing records? Common sign of potential fraud in billing records. Option A, high volume of claims with the same diagnosis. Option B, frequent billing for preventive services. Option C, occasional discrepancies in patient records. Option D, adherence to billing guidelines. The right option is option A, high volume of claims with the same diagnosis. Next question, how can waste be defined in a healthcare setting? How can waste be defined in a healthcare setting? Option A, excessive use of resources without benefit to the patient. Option B, intentional misuse of services for financial gain. Option C, unintentional mistakes in documentation. Option D, overbilling for services provided. So, waste is excessive use of resources without benefit to the patient. Option A is the correct option. Next question, which federal agency is primarily responsible for investigating healthcare fraud? Which federal agency is primarily responsible for investigating healthcare fraud? Option C is the right option. OIG, Office of Inspector General. This is very important and repeated question. Next question, what is the purpose of the OIG's safe harbors regulations? Option A, to define safe practices for billing. Option B, to protect certain practices from prosecution under the anti-kickback statute. Option C, to enforce penalties for fraudulent activities. Option D, to establish billing codes. Option B is right option, to protect certain practices from prosecution under the anti-kickback statute. Next question, which of the following is a key element in providing fraud? Which of the following is a key element in providing fraud? Option A, the provider's intent to deceive. Option B, the amount of money involved. Option C, the frequency of errors. Option D, the level of documentation. The right option, option A, the provider's intent to deceive is a key element. Intent to deceive is the key element in proving the fraud. Next question, in which scenario is upcoding most likely to occur? In which scenario is upcoding most likely to occur? Option A, billing for a higher level service than what was provided. Option B, billing for a lower level service than what was provided. Option C, billing for services not covered by insurance. Option D, billing for duplicate services. And the right option is option A, billing for higher level service than what was provided. Next question, which act establishes penalties for false claims in healthcare? Which act establishes penalties for false claims act? And the right option, False Claims Act. Option B is the right option, False Claims Act. Next question, what is the main purpose of the Stark Law? What is the main purpose of the Stark Law? Option A, to prevent fraud in billing. Option B, to regulate physician referrals and financial relationships. Option C, to manage waste in healthcare services. Option D, to enforce patient privacy rules. And the right option, option B, to regulate physician referrals and financial relationships. Next question, which of the following best describes a kickback? Best describes a kickback. Option A, payment made to a physician for referring patients. Option B, payment made for services rendered. Option C, reimbursement for out-of-pocket expenses. Option D, legitimate business transactions. Option A is the right answer. Payment made to a physician for referring patients. And next question, which of the following actions is considered abuse? Which of the following action is considered as abuse? Option A, billing for services that were not necessary. Option B, misrepresenting the nature of services provided. Option C, accepting gifts from pharmaceutical companies. Option D, allowing incorrect billing procedures. Option A is the right answer, billing for services that were not necessary. Okay. Next question, what should a healthcare provider do if they suspect fraud? What should a healthcare provider do if they suspect fraud? Option A, ignore the suspicion to avoid complications. Option B, report it to the appropriate authorities. Option C, discuss it with the patient. Option D, modify the billing to align with the suspicion. Option B is the right option, report it to the appropriate authorities. Next question, which document outlines the compliance program requirements for healthcare providers? Which document outlines the compliance program requirements for healthcare providers? Option A, HIPAA privacy rule. Option B, Affordable Care Act. Option C, OIG compliance program guidelines. Option D, STARCLA regulations. So outlines compliance program requirements is OIG compliance program guidelines is the right option, option C. Next question, what is the main focus of the False Claims Act? What is the main focus of the False Claims Act? Option A, preventing abuse in healthcare. Option B, addressing fraud involving government programs. Option C, regulating physician practices. Option D, ensuring patient privacy. So right option is addressing fraud involving government programs. Main focus of the False Claim Act is addressing fraud involving government programs. Next question, what constitutes an overutilization of healthcare services? Overutilization of healthcare services. Option A, providing more services than are medically necessary. Option B, providing fewer services than required. Option C, accurate billing for all services. Option D, efficient use of healthcare resources. And providing more services than uh, medically required is the right option. Okay. So option A, providing more services than are medically necessary. Next question, which of the following is an example of a wasteful practice? Option A, requiring duplicate diagnostic test. Requiring duplicate diagnostics tests. And option B, implementing evidence-based treatment protocols. Option C, following standard billing procedures. Option D, providing preventive care services. And the right option is requiring duplicate diagnostics test. This is example of wasteful practice. How is abuse typically differentiated from fraud? How is abuse typically differentiated from fraud? Option A, abuse involves intentional deception while fraud involves unintentional mistakes. This is wrong option, right? And next option, abuse involves unintentional practices while fraud involves intentional deception. This is the right option, right? Option B is the right option. Only abuse involves unintentional and fraud involves intentional. This is the major difference between abuse and fraud. And if you see option C, both involves intentional act, this is also wrong. Option D, fraud involves lower financial stakes compared to abuse. This is also wrong. Next question, what is a common method for detecting fraud and abuse in healthcare? Common method for detecting fraud and abuse in healthcare. Regular audits and reviews of billing practices is the right option. Regular audits and reviews of billing practices that should do is a common method to detecting the fraud and abuse in healthcare systems. Okay, option A is the right option. Next question. What should a healthcare provider do if they discover an error in their billing practices? What should a healthcare provider do if they discover an error in their billing practices? Option A. Correct the error and report it if necessary. Correct the error and report it if necessary is the right option. And next option, if you see, ignore the error if it is minor. Continue with the incorrect billing to avoid complications. Conceal the error from authorities. All three options are wrong. First option is the right option. Correct the error and report it if necessary. Next question, which type of fraud involves submitting claims for services not rendered? Which type of fraud involves submitting claims for services not rendered? This is called phantom billing. Which type of fraud involves phantom billing? Phantom billing involves submitting claims for services not rendered. What is the primary objective of compliance training for healthcare providers? What is the primary objective of compliance training for healthcare providers? Option A, to teach providers how to commit fraud without detection. To teach providers how to commit fraud without detection. Option B, to ensure providers understand and adhere to legal and ethical standards. Option C, to increase billing efficiency. Option D, to minimize paperwork. Option B is the right option, to ensure providers understand and adhere to legal and ethical standards. Next question, which of the following is a consequence of healthcare fraud? Which of the following is a consequence of healthcare fraud? Option A, legal penalties and financial restitution. Option B, increased patient trust. Option C, enhanced provider reputation. Option D, improved healthcare outcomes. So option A is right option, legal penalties and financial restitution. Next question, what is unbundling in the context of medical billing? What is unbundling in the context of medical billing? Option A, separately billing for services that should be billed as a single comprehensive package. Separately billing for services that should be billed as a single comprehensive package. This is the right option. Okay. Next question, how can healthcare organizations prevent fraud and abuse? How can healthcare organizations prevent fraud and abuse? Option A, by implementing comprehensive compliance programs and regular training. And this is the right option. By implementing comprehensive compliance programs and regular training is the right option. In this way, healthcare organizations prevent fraud and abuse. Okay, that's it for today's session, guys, and we'll meet in another video with different topic. Thank you.